One point I would like to make, we know that prostate cancer is very common, and therefore it's not uncommon to have a family member. If you're diagnosed with prostate cancer, you probably do have a dad, a brother or uncle who's had the disease. And we actually saw a patient on Thursday, Abel and I, 47-year-old gentleman whose PSA was 10 times normal for his age. His father had had prostate cancer. His uncle had had prostate cancer, but treated over 20 years ago. And he was absolutely adamant he was not going to have a biopsy under any circumstances because of the disastrous consequences of his father and his uncle in terms of the treatment. The father in particular had had a disastrous complication, which thankfully I've never seen in my career, but I can understand why he was so reluctant to get treatment himself. And I think we need to remember that, because often patients come to me and say, I've just been diagnosed with prostate cancer, but I'm not doing anything about it because my dad in 1972 went through this, this and this, and he was very traumatized by the side effects of treatment, and we have come a long way. So we want to bring that up, and maybe Deborah will say more a bit about her father having treatment several years prior. The other thing I'll say is that 20% of my patients come to me for a second opinion on an aeroplane. They fly in the night before, blah, 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 and then they have a 30-minute appointment, and they'll spend easily 20 minutes shuffling papers. And it's so upsetting when you want to focus on the story and give them the advice. So I can't emphasize enough, get organized. And if you can get a file and maybe break it up and say, well, here's my PSA results, here's my MRI report, here's my CAT scan report. And ideally, don't just go with the originals, go with copies. Because if you have 10 reports and you hand them to a doctor, you're probably going to get 7 back. 1 gets left on the photocopier. But so often patients waste such valuable time when they're in front of a prostate cancer expert. And one of my biggest bugbears is that patients will come with an MRI, but they don't have the disc, and you want to look at the disc, or they've got the report, or they tell you that the report is on the disc. And if you have scans, try and get the CD, whether it be a CAT scan, a bone scan, an MRI, try and get the CD of the images. Is so valuable, because nothing worse than travelling 3,000 miles for an opinion to be told, come back next week with your images on a disc. So those are a few things that I wanted to just bring to everyone's attention. And it's amazing how great a partner can be at getting the paperwork organised.